Hello again, everyone. I'm Dr. Steve Vargo, and this is episode 8 of Can I Ask You One Question, where we dive into the minds of industry experts and gurus and thought leaders. And we just try to learn one critical thing from them that we could apply to our professional lives, maybe even our personal lives. And the topic today is telemedicine. And I have with me here Dr. Mike Rothschild, CEO of Leadership OD. Welcome, Mike.
Thank you so much, Steve. It's a pleasure being here with you.
So, Mike, when you mention telemedicine to a group of ODs, I think you get a mix of different reactions. I think, as with any disruptive technology, you're going to have people that some of them embrace change and innovation, others resist it. Maybe there's some fear that goes along with it. And with you being a bit of a trailblazer in the telemedicine scene, my question to you is maybe a two-part question. One is, how are you using telemedicine currently in your practice, and what role do you think telemedicine will play in the future of optometry?
Okay, yeah, so those are some really good questions. So the first question, how am I using it now? So one of the things that whenever I start a conversation about telemedicine and optometry is I like to make sure that we're all speaking the same language, talking about the same thing, because there has been such a variety over the last several years of what people mean when they're talking about telemedicine and optometry. And a lot of us think of online apps, where you just log into an app on your phone and maybe you take an eye test and wind up with a glasses prescription from that without ever talking to anybody. And we're all opposed to that. None of us think that that's good for our patients. We don't think that it's good for our profession. And that's something called asynchronous care, meaning that you're using some sort of tool online to get healthcare information or healthcare advice without talking to anybody. That's asynchronous care. And there are forms of asynchronous care that's good, but not in eye care so much. Synchronous is kind of the connection you and I are having right now, where we can see each other, we're talking to each other in real time. That's the way that you want to connect with a patient and give them care. You have limitations on what you can see, what you can talk about, but there's a lot of things that you can do that way. So that's synchronous care. And again, I think it's important to say that at the beginning, just to make sure everybody's talking about the same thing. So a year or so before COVID, I started a practice with the main premise being that we could deliver eye care remotely. So we did what's now known as a comprehensive eye exam with a remote provider. So it's just like any other eye care practice. You go in, we've got autorefractors, retinal cameras, all sort of instruments where the patients come in, they have all this testing done, and then we remote in and we control the phoropter digitally. We control the eye chart and actually do a subjective refraction while talking to the patient. And then we do the history and listen to the complaints, make recommendations through the internet. So we put the monitor, the computer monitor right where I would be sitting if I were in there, and we're face to face, just like you and I are face to face right now. So that's a comprehensive exam with a remote provider. And I've been doing that for a couple of years now. Now, during the pandemic, we've also been adding a type of telehealth. It's also synchronous because we're connecting, but it's called a VAHO. It's a virtual at-home optometry visit. And that means you're just logging on the patients at home, obviously, and you're connecting with them through some type of device like Zoom or Doxy.me or any of these kind of apps where you're connecting and you're doing certain eye tests and taking care of your patients that way. Follow-up visits are done that way, contact lens progress exams, even triaging emergencies can be done. You can talk to your patients, ask them what they mean about flashing lights, how long they've been seeing them, let them show you what part of their field that they're in. You can look at a red eye and see if it's conjunctival hemorrhage. Just all these different things can be done so you can determine how big of an emergency it is. And that's used in combination with seeing them in your office, that way. So we're doing both of those. So that's the first question, or the first part of the question is how I'm using it now. And the second part, where's it going to go? Boy, I just am so anxious to see. I have a chance to work with students at UAB School of Optometry. And what I always tell them is, you are the generation who will define how our profession uses telehealth, because it can really go either way, Steve, right? Like you were saying earlier, some of us are really in favor of it. Some of us are really opposed to it and want to fight it as much as we can. But I think most optometrists are kind of in the middle, thinking this is interesting. Now that I think about it, I think that there's some good to it, and maybe I can utilize it to serve my patients, but it's not the same thing as seeing in person. It really has to be kind of a hybrid care model. But I think it'll grow. I think that we'll see that we can do more and more to take care of our patients. I think that we'll find that there's more opportunities to enhance the care that we give to our patients. I don't think we'll all do it. I think some will dive right in and it'll be a main part of their practice, and some will just not have anything to do with it. Just like, vision therapy. There are some practices that's all they do. Some practices think that it's crazy, but most of us recognize the need for it, and get people there if we can use it whenever we can. So that's about where I think, and I feel like I've been rambling a little bit, but it's a really, really great question.
Yeah, I appreciate the answer. I appreciate too the distinction, because I think that's where a lot of the fear comes in, between where it adds value and where it adds benefit versus, I think, some of the lesser attractive qualities of it that we've seen that scares some ODs. I think that gets a lot of times just lumped under the same term of telemedicine, but it's not all the same. I appreciate that distinction. Do you see the biggest application of it in more remote care? Because I noticed, you mentioned that before we got on the call, the application toward areas that it's accessibility to, maybe there's lower accessibility to eye care. So that's one area, but another one is just looking at trends. I like to tell people, if you want to see what the future world looks like, look at kids. I've got a 14 and a 12-year-old. Neither one knows a world where you can't get anything you want right now at the touch of a button. Right. So is what seems scary right now, 5 years from now, 10 years from now, 15 years from now, going to be much more of the norm? Any thoughts on maybe just those two areas as far as being major applications of a future version of telemedicine?
Yeah, so like I said, I think it will evolve and it'll change to sort of fill the needs that people have. I definitely became interested in it because of the possibilities that it has to provide eye care in remote areas, where I think there's a growing problem with access to eye care. I think that problem is getting bigger and bigger. So I'm anxious to try to solve that. And that's what piqued my interest in the entire concept. So definitely it has a need there. But there's also areas in big cities that I've learned along the way where there's people who have trouble having access to care just because of transportation issues or the availability of somebody in their neighborhood. But I fully agree that society is becoming less and less patient about waiting for care and wanting care when it's convenient for them. So I do think that it'll grow. And our job, and what I call it rule number one, our job is to make sure that we have enough information to make a good clinical decision based on the patient's individual needs. So if we can't get enough information from these instruments to decide what this patient needs and to deliver them that care, we have to insist that we find another way. And if that means continuing to bring them into the office, then we just need to make sure that we're doing that. So it's finding the balance, right? We don't want to just bring them in just because we can, but if we can't get that information through technology or through communication, we got to keep insisting that it does. But man, it just keeps getting bigger and better and stronger as we go.
Yeah. Thanks so much, Mike. Thanks for your insight. This was great. I think, maybe a theme here is don't be afraid of it. Look into it, see how it applies to you. Try to extract the good. As with all new technology, before you brush it off, take a good look at it and see if it's something that could add value to your practice. So thanks so much for coming on. Thanks everyone for listening. You can find all the show notes for this and all previous episodes at drstevevargo.com. So thanks again, and we'll see you next time.